Some of our medications could have unfavorable effects on the kidney when taken without a doctor's prescription. Filtering blood, controlling fluid balance, and regulating blood pressure through hormone release are just a few of the many vital roles that your kidneys play in your body. However, some medications can make it more difficult for the kidney to perform these vital functions, and can also damage it. In light of this, the following medications should never be taken without a doctor's prescription. Here are some medications to avoid because of the risk of kidney damage. Incorrect use of the following medications might lead to renal damage. 1. Antibiotics. The most common culprits are antibiotics, which can have a wide range of potential negative effects depending on the medicine and the dosage. Certain medications, for instance, have been linked to the formation of crystals in the urine, which can hinder the kidneys from filtering them out, while others have been linked to the damage of particular kidney cells. Diuretics are prescribed for high blood pressure and moderate to mild edema. As a bonus, they help the body get rid of the excess fluid that can otherwise harm the kidneys and cause dehydration. Nonsteroidal anti-inflammatory medications, NSAIDs. Third, NSAIDs. Even though they are available over-the-counter, pain medications including aspirin, ibuprofen, Advil, Motrin, and naproxen, Aleve, should not be used routinely, in large doses, or for an extended period of time. 2. Toppings and fillers. It's important to be careful when using dietary supplements, as some of them might be harmful to your kidneys, like wormwood oil. Consult your doctor before beginning the use of any new dietary supplement. 3. Laxatives. Certain individuals may benefit from the softer feces that laxatives provide in order to encourage bowel movement. The production of kidney-damaging crystals has been connected to the use of laxatives such as oral sodium phosphate, OSP. Keep in mind that the abuse of painkillers is a leading cause of chronic renal failure, accounting for up to 5% of annual cases. 4. Antacids. Pharmaceuticals such as Acifex, Omeprazole, Prilosec, and Prevacid, among others, are available to treat acid reflux, ulcers, as well as heartburn. Unfortunately, they also help reduce stomach acidity, but long-term usage has been related to renal damage and sometimes even kidney failure. If you have a kidney condition, talk to your doctor before starting any new medication.